Enhancing End-of-Life Care Program.
I move item 837 standing in my name. Let's begin with the maths. The Coalition Government committed $650 million in recurrent funding over 5 years for a world-class end-of-life care enhancing end-of-life program, Palliative Care for short. Then, in the 2023-24 budget, the incoming Minns government reduced the funding envelope to $401 million. Yes, there is still money being spent on palliative care, but $250 million less than had been previously provided in the forward estimates. In lay terms, $250 million cut, and a cut which will affect the provision of palliative care to the dying in every local health district in this state. Each local health district had begun to spend their allocated funds and had prepared detailed business cases for how palliative care services in their district would be delivered. These plans are now in tatters because the money which would have funded them has been slashed. So it's hard to say exactly how many nurses, how many allied care workers, and how many doctors will no longer be employed, or how many patients will now die without access to adequate palliative care. The local health district, which covers the Health Minister's own electorate, the Illawarra Shoalhaven LHD, in their business case, indicated an existing 38% unmet need for palliative care. With these funding cuts, who will now meet the needs of these patients? Even worse, the Paediatric Palliative Care Specialist Network has had their funding over the 5 years to 2027 reduced by 50%. If you want an example of economic spreadsheets taking precedence over vulnerable and the dying, look no further than this. The Treasurer cuts funding for dying children by 50%, the Health Minister says no cuts to see here, and the children suffer. Unfortunately, the story of these cuts continues, and the figures are grim. Hunter New England Local Health District has lost almost half of its funding, a 42% cut to the palliative care funding provided by the Coalition Government. What will happen to the Aboriginal health workers which that LHD had planned on hiring to provide culturally safe and sensitive care to the sick and dying of their already vulnerable community? In the 5 years to 2027, the Central Coast LHD was going to spend $466,000 on Aboriginal palliative care. Will they still be able to afford this after the government's 36% cut to their palliative care funding? Northern New South Wales LHD has lost 39% of their funding. What will happen to the new 15 palliative care nurses which they had planned to hire? And we saw yesterday the announcement that the funding to Silver Chain, which provides community palliative care services in the home in the Western Sydney LHD, will end as at 30 June this year. And in an Orwellian announcement, Minister Park has said of this funding cut, "I am pleased to announce that more people in Western Sydney Local Health District who need palliative care will be able to receive it as a result of our expansion of community palliative care services." An expansion which involves a cut in funding from $11 million a year to $8 million and no guarantee that all the care providers will retain their jobs. How can this be described as an expansion? Palliative Care Australia expects demand for palliative care to grow each year until 2030. They recommend 2 full-time palliative care physicians per 100,000 members of the population. In New South Wales today, some districts have as few as 1 physician per 200,000 members of the population, a clear need which the Coalition addressed and Labor is choosing to put at the bottom of the agenda. And sadly, there is no guarantee that these cuts are over. I asked the Minister for Health directly in budget estimates to guarantee that there will be no further cuts for the dying. He could not do that. The Minister for Health has described these cuts as a slight slowing of growth. If only those in need of palliative care could slow their rate of dying to match his budget cuts.